Hey, how are you?
Good.
My name is Michaela. I'm a student nurse at Tuskegee University, and I would like to perform a head-to-toe assessment on you. Is that okay?
Yes.
Okay, so can you state your first and last name for me?
Keldon Thompson.
Your date of birth?
May 6, 2004.
Do you know what today is?
November 13th, 2020.
Do you know where you are?
Case Clinic.
And what is today's date?
November 13th, 2020.
And who is the current president?
Joe Biden.
Okay, patient is Orton times 4. He's able to state his first and last name. I'm going to practice hand hygiene. Have you been having any pain anywhere? Soreness?
No.
Okay. So first, I will start with my patient's hair. Of course, I have on gloves. I would check for any infestations, baldness such as alopecia. The moisture of the hair is really nice. Does that hurt anywhere?
No.
Alrighty. So also come around to the front side of my patient's face. I'm going to assess his eyebrows. They're nice and thick. They're even. Eyelashes are nice and even as well. And also his overall general appearance is nice. His skin is clear of all lesions, bumps, or bruising or swelling. He's well groomed. He's appropriately dressed as well. Can you do like this for me? Fingernails are very clean and well clipped. Also, his eyes and his ears align with each other. They do not sink in. You've been having any pain or anything in your ears? Any ringing or anything like that?
No.
Okay, just let me know if you got any pain anywhere. And that hurts?
No.
Any of that hurt?
No.
Okay. So while we're talking about your eyes, I'm going to check your pupils, okay? Can you look at this clock on the wall behind me? Okay, pupils constrict. Constrict. To the other side. Constrict. Constrict. Also, check this. Alrighty. Okay, so my patient's eyes, they're round, they're equal, they're reactive to light. So I'm gonna check your accommodation now. I want you to follow my pen light with only your eyes and do not move your head, okay? We're gonna go straight to your nose, but only with your eyes, okay? Okay, so the patient eyes also accommodate. Have you been experiencing any drainage or itching or burning of the eyes lately?
No.
Okay, so I'm going to assess my patient's nose. Have you been having any drainage or anything in your nose? Any swelling?
No.
Can you touch your hair back for me? Be checking for any deviated septum, swelling, bruising, or bleeding, and I see none. Can you conclude one side of the nose and blow out for me? And the other? Okay, patient does that with ease. Overall, it's pretty good. I'm going, his lips are nice and pink and moisturized. There's no dryness of lips. Can you open your mouth for me? Observing my patient's teeth. They're nice and clean. No bad sound or bad breath. He has a retainer there. Can you stick out your tongue for me? Can you swallow for me? Okay, everything there looks good. There's no lesions or blistering, anything of the mouth. So while we're still talking about your nose, I want to do a test to test your sense of smell, okay? So I want you to close your eyes and I want you to identify both smells, all right? Close your eyes for me.
It's peanut butter.
Okay.
Mustard.
Okay. So And since the smell is there, I want you to be able to identify what this taste is. I know you know what it is, but I want you to identify the actual taste. Okay. Okay, so also I want to check my patient's neck. The trachea should be nice and midline. It hurts, anything like that? No. Check thyroid gland. Swallow bone. Okay, good. Now I want to go down to my patient's chest. Going to check the thoracic area. Also check posterior and anterior chest. But before I do that, I want to check my patient's carotid artery. Okay, nice and strong. So, have you been having any pain or anything in your neck lately?
No.
Can you turn your head left to right? Okay. Full circle. All right, and up and down. Good. Also, can you turn your head and look that way for me? I'm going to assess the jugular vein. There should be no distension of the jugular vein. And also, while I'm here, I'm going to palpate the lymph nodes and the temporal artery. Does that hurt?
No.
Can you open and close your mouth for me? No clicking sensations there. Okay, good. And that hurts in that area. That?
No.
That hurt?
No.
Okay, good. So I've assessed his lymph nodes and things like that. I'm going to listen to your lungs, okay? Now every time that you feel me putting my tool in a different spot, I want you to take a deep breath. Just breathe normally, okay, for me? And also with the lung assessment, before you actually auscultate, you want to inspect, look over the general overall appearance of my patient's chest. Can you lift your shirt up for me, so right up under your chin? Okay, you can relax. Okay, so overall skin of the chest is good. I'm going to listen anterior and posterior chest. Deep breath. Okay. Okay, so lungs sound really good. There's no adventitious breath sounds such as crackling, wheezing, or stridor. Now I'm gonna go to the patient's abdominal region. Have you had a bowel movement? When was the last time your bowel movement?
This morning.
This morning, okay. Stomach looks good. There's no lesions, no bumps or bruises, anything like that. I'm going to listen to your abdominal region first, okay? Then I need to also palpate for it, okay? I'm gonna start in the left lower quadrant. I'm listening for any stomach sounds. Okay. Let me know if you have any pain first. I'm gonna do a soft touch first, then I'm gonna go deeper, all right? Just let me know if you feel any discomfort. Anything there? Okay, I'm gonna go deeper now. Okay, so now your stomach area feels good. You deny anything of like any discomfort. Now, you can lower your shirt. Can you lower your shirt for me? Now, while I was accessing your lungs, I should have check the back. Can you say every time you feel me go in a different spot? Say 99, okay?
All right. 99.
Okay, good. All right. So now I'm going to assess. I will check my patient's cardiac system. I'm going to check my patient's cardiac system. I'm going to listen to your heart, okay? So just breathe normally for me. Any family history of cardiovascular disease?
No.
Okay. Okay. Able to hear S1 and S2. You're nice and strong. Now, are you experiencing shortness of breath? Anything like that when you're doing your daily activities?
No.
Okay. So now, I've done the abdominal region. I'm going to move down to the perineal area. Okay, so as far as the perineal area, you would ask the patient to move their shirt just up under the breast and have him lower his pants to mid-thigh. Remove his underwear as well. You would inspect the penis. Look at the shaft and the glands of the penis for any infestations, any odors or swelling, anything like that, any drainage of discharge. Now, if the patient is experiencing discharge, you want to, of course, ask the patient if you can take a sample. You will pinch the glans penis between your thumb and your index finger and squeeze it so you can get more of the substance onto the Q-tip. And of course, store it properly and send it off to the lab. You would inspect the overall skin of the area for any discoloration or swelling, any bumps, lesions, clusters of vesicles, any bleeding, anything like that. And palpate and make sure there's no lumps